My Lords, I rise to offer Green support for all of the amendments in this group. I'm going to group them into two groups internally, 6, 19, 60 and 215, and deal with 21 and the Noble Lord Davies separately. All of these are about transparency and targets. Now, I think when we look back to when targets were a particular focus when the NHS was under the control of the party on these benches, there was concerns that targets could actually sway provision, could sway medical judgments. There was a concern that this was management for the target margin, managing for the best outcome for a patient. However, I think it's really important if we think of these as foundations, basic standards that need to be met. And then what we need to see is to ensure that there's enough funding for local priorities, local concerns to actually be addressed to reach a higher level. And I think it's really interesting that when we look at all of these, and particularly 215, which I note has full cross-party support, an annual report, this is about people knowing what the NHS is achieving and, really importantly, whether there is enough provision in the NHS. Because, of course, your Lordship's House is not in a position to demand that more money go into the NHS. By constitutional norms, we can't deal with spending. Yet I think we should have to frame this debate, and I'm speaking, this is my first contribution to committee stage, is if you look at pre-COVID figures, the UK was spending £2,989 per person on healthcare, which was the second lowest in the G7. France was spending £3,737, Germany £4,432. Of course, the great outlier in this is the US, spending £7,736 a year. Yet I think it's really worth noting that we seem to be chasing so much after the US healthcare model that's so absolutely disastrous. And so, in a way, I would say most of the amendments in this group are a way of your Lordship's House trying to give the public tools to say we need to improve the resources of our NHS. Now, I think the Noble Lord Warner really got to the point of saying how much under pressure this system was even before we hit COVID-19. And I do want to briefly draw your Lordship's attention to the Central Bylines website and a tragic report of the death of Jacob Roach, written by his wife, June Roach. Now, I was going to talk about this in detail, but I'm aware of the time, I won't. But I would really urge Noble Lords to look at the incredibly, and this is from December, so it's before Omicron, the incredibly stretched nature of our NHS, which can't be solely attributed to COVID, as the Noble Lord Warner said. Now, turning briefly to Amendment 21, and this does sit rather oddly in this group, and I think it will raise many issues that I raised at second reading that will come up in later groups. But I would associate myself with all of the comments of the Noble Lord Davies of Brixton in terms of the concern about the private sector involvement. And I think my reading of the Noble Lord's amendment doesn't actually mean that it addresses a community-run hospice or a local consortium of physiotherapists. What it's particularly looking at is the integrated care boards and the involvement of private sector in management systems. Because if you actually look at the US system, an analysis of the US system and why it's so expensive for such disastrous results, administrative costs are a really important part of that factor. So I would say that we should have the profit motive should have no place in healthcare. And if we think about the cost of the profit motive, there's its influence on decisions, because after all, the private company's job is to make profits. But there's also the fact that money going in profits is not going to healthcare.